Do you have a horse that pins their ears when you put the saddle on or when you start doing up the girth? Or do you have one that escalates it to the point where they're biting at the air, grinding their teeth, or turning around and trying to bite at you while you do up the girth? If you do, there's a very, very high chance that your horse is experiencing pain. Alternatively, it could be due to a pain memory that they're still responding to after the pain has been resolved, but this behavior comes about due to discomfort. This type of behavior is typically referred to as girthiness or cinchiness. And this is because it happens when the girth is being done up or the cinch is being done up if you ride Western. Or it can sometimes happen just from the saddle being on because that predicts the girth being done up, but typically it's the girth that bothers horses the most. Far too often people word this as just being a quirk for their horse or just being the personality. I've seen a lot of people blame this on a horse being a mare as well and saying that they're just being marish and that this is just a mare thing. Most recently, I saw someone on here post a video of their horse trying to bite them while they're doing up the girth, and they just said that it's just because she's a chestnut mare. There is literally no evidence that being a mare or being a chestnut increases any risk of behavioral problems whatsoever. Absolutely no proof of that. However, anecdotally, from experience as a horse trainer, I've been present for tons of different vet checks, and I've also handled lots of different horses. Unanimously, all of the ones that have had this problem either had a poorly fitting saddle or had ulcers or had some type of lameness that resulted in discomfort, and they hated the girth being done up because it either hurt them when the girth was being done up or it predicted going and riding and causing them more pain. So even if the girth itself is not what's causing them pain, it predicts going and being ridden, which if they have like a spinal issue or any type of lameness could be painful. In a study done on 37 horses who had girthing issues, 10 of those 37 horses were found to have spinal osteoarthritis, bone spavins, front limb lameness, or other orthopedic problems, and their behavior improved once these conditions were treated. Likewise, gastroscopy showed that 12 of the horses had stomach ulcers. In all of the horses who had ulcers, treatment with omeprazole resolves the girthiness within 6 months. Also, even if your vet has looked at your horse, unless they have actually specifically gastroscoped them, they cannot say whether or not the horse has stomach ulcers. And the horse could also have hindgut ulcers, which cannot be scoped for. The remaining 11 of 37 horses had a variety of diagnoses ranging from non-specific withers and sternum pain to ovarian tumors to urinary tract infection. Only one of the horses had girthiness attributed to a behavioral problem. 1 out of 37 horses. That is 0.03% of horses in this study. So basically, if your horse is cinchy, there's a very high chance that they have some type of pain, may it be related to poor saddle fit or something else. But there's a high chance of them being in pain. And that pain needs to be addressed before you can start reliably counter-conditioning the girthiness. If it is just a pain memory, you can then counter-condition it by giving the horse something nice when you put the girth on, changing it from a negative experience to a positive one.